I'm very pleased to be in your midst this evening in the context of the World Renal Day, which was celebrated on the 10th of March this year. At the very outset, I wish to commend the excellent work of the doctors who have undertaken through the Renal Association, and they all been regrouped over here, and this work is commendable. Congratulations. This initiative for the welfare of your respective patients and for the betterment of your work as health professionals is indeed laudable. It certainly allows for the sharing of experience, expertise, and good practice. It also establishes a sound collaboration between the public and the private health sectors. The theme for this year's World Kidney Day invites us to bridge the knowledge gap to better kidney care. This pledge echoes what we have outlined to achieve in our health sector strategic plan 2020-2024, whereby we are encouraging patients to become our partners in health. Ladies and gentlemen, the last 2 years have been challenging for us because of the COVID-19 pandemic. This invisible enemy poses an even greater threat for patients with kidney problems and undergoing dialysis. This situation is not unique to Mauritius, and like other countries, we also have sadly had casualties among our dialysis patients. Today, it is fitting that we honor their memory and that we continue to work so as to ensure that dialysis patients continue to live as normally as possible. The Ministry of Health and Wellness has already implemented 90% of the recommendations made by the fact-finding committee following the demise of COVID-19 positive dialysis patients. We remain committed to keep on improving the service dispensed. I'm confident that we will achieve our objectives in record time, and this also greatly depends on your commitment as health professionals. I'm also very pleased to see representatives of NGOs and associations working for the welfare of dialysis patients among us this evening. I believe that together we are working in the right mindset and with the required approach, as we will not be able to succeed in isolation. We should consolidate the trust established between ourselves and our patients. The Ministry is leaving no stone unturned to pursue its efforts aimed at offering better treatment to dialysis patients and those living with kidney problems. Not later than last week, we inaugurated the new dialysis unit at Suyak Hospital, which can now cater for more than 130 patients. Last year, we launched the dialysis services at the Montaignon Hospital, where some 110 patients are currently receiving treatment. Our stride towards progress will not stop here. Soon, we will renovate and upgrade services at the dialysis units of all regional hospitals. We purchased new 90 new dialysis machines to the tune of some 25 million rupees in 2021, and by May this year, we should receive 80 more dialysis machines. One of the forthcoming landmark projects to alleviate the situation of renal patients is undoubtedly the Renal Transplant Unit at Nehru Hospital. We will be supported in our endeavor by the Indian government, and I am informed that works for this project will soon start. My ministry is also investing in the professionalization of the staff. We are already working with foreign universities to devise courses to our doctors. In the same vein, we are also working with the Mauritius Institute of Health to provide our nursing staff with courses leading to a certificate in nephrology. Ladies and gentlemen, the Ministry will continue to upgrade the services in the coming years. However, we will also keep on working to better sensitize our citizens on risk factors which lead to kidney problems. The booklet on renal diseases, launched last week, is a perfect tool which will undoubtedly enlighten the public on the do's and don'ts, which will help them to stay in good health. I will also invite you as health professionals to further engage in pedagogical and informative dialogue with your patients as well as their families to create trust and bonding. I'm confident that with such teamwork, whereby health professionals, patients, NGOs, and the ministry are all taken on board, patients will undoubtedly reap the fruits of our commitment.
The Renal Association was set up about 2.5 years ago by a team of 8 nephrologists. We initially had only 8 members, and slowly the numbers grew. We now have 27 members, consisting of nephrologists, surgeons, general practitioners who support us and share the views and aims. Our motto is kidney health and awareness for all, and one of our aims is to promote the specialty of nephrology and raise awareness of kidney disease in Mauritius. Hence, today's event and the many previous talks and symposiums, which many of you have heard of and hopefully attended and will attend in the future. The World Kidney Disease Steering Committee has declared the year 2021 the year of living well with kidney disease. This has been done in order to both increase education and awareness about effective symptom management and patient empowerment, with the ultimate goal of encouraging active participation from all stakeholders. While effective measures to prevent kidney disease and its progression are important, patients with kidney disease, including those who depend on dialysis and transplantation, and their care partners should also feel supported, especially during pandemics and other challenging periods.